Pain management. Why is it important for your health? Pain is a normal part of life. Pain is a normal part of life. We have all experienced pain at some point. Sometimes pain is very serious, such as the pain from a broken bone. At other times, it is rather minor or a mere nuisance, such as pain from a small bruise. Other times, pain can be intermediate, such as that we feel with a sprained muscle. However, regardless of the severity of pain, it is important to manage it to optimize your happiness and your health. What is the purpose of pain? Usually, pain serves a valuable function in protecting us. The classic example is when you put your hand on a hot stove. The pain tells you to remove your hand quickly so you don't suffer permanent disfiguring burns. This brief amount of pain protects you from a more severe injury. The pain that occurs with the resulting blister causes you to protect the area until the burn and the blister are healed. This acute and subacute type of pain is vitally important for our health and survival. Let's talk about pain in a minor injury. In a less severe example of pain, such as a bruise, pain also serves a function. Take the case of a bruise as an example. Minor injury, such as backing into a sharp corner or bruising your leg, causes an immediate pain. This pain causes you to stop and assess where you're going. This alone may prevent a more serious injury. The bruise that results is a discoloration that occurs because of disrupted blood vessels in the skin, subcutaneous tissue, and underlying muscle. Treatment of the bruise is simple. Simply avoiding hitting the area again is usually sufficient, and the bruise usually resolves spontaneously. Icing the area may be helpful in the first several hours to decrease inflammation in the area. If the pain persists, over-the-counter analgesics such as Tylenol or ibuprofen may be helpful. Pain management in an intermediate injury. The intermediate injury, such as straining or spraining of muscles, requires a little more care. These sorts of injuries can be due to an acute strain, which can occur, for example, in a whiplash injury, overexerting while lifting, or slipping and falling. Sports activities are also common causes of such sprain injuries. Low back pain, as well as pain in other parts of the body caused by this sort of injury, fortunately usually heals rather quickly. At other times, sprain injuries can be chronic and due to long-term poor positioning, such as slouched posture, as can occur while working at a computer terminal day in and day out. Without proper stretching, muscles that are in an awkward or strained position for extended periods of time can be injured with a seemingly minor task, such as reaching down to pick up a piece of paper off the floor. Lifting the piece of paper is not what caused the strain. The multiple stresses and strains on the muscle in the low back, for example, led to a condition that predisposed the person to injury with only minimal strain on the structure. In the low back pain caused by a strain or sprain described above, the appropriate pain management approach usually involves correcting the environmental stressors, such as poor work posture. Proper treatment also may involve resting for 1 or 2 days and applying ice to the low back intermittently to help decrease inflammation. Anti-inflammatory medication can also help decrease pain and decrease inflammation. Acetaminophen also may be helpful in reducing pain. Extended periods of rest, in most cases, is not helpful and can actually decrease the rate of returning to maximum function. However, after a few days of complete rest, slowly increasing activities back to the normal range may be necessary over several days to a few weeks. Massage, stretching, and ice, along with anti-inflammatory medication, may help speed the rate of healing. Pain in a severe injury. Other, more severe pain, such as that we get with a broken bone, in an arm or a leg, for example, also serves a function. The severe pain lets us know that we have a severe injury. The excruciating pain of a broken bone also forces us to stop what we're doing that caused the bone to break in the first place. It forces us to seek help immediately. It also forces us to minimize activity until the bone is healed. Again, we see that pain can be protective and helpful in certain circumstances. A severe injury to the spine, such as a fracture or large herniated disc, usually causes very severe pain. Oddly enough, if the back is completely broken and the spinal cord is severed, this injury is often associated with little, if any, pain, since the nerves cannot transmit signals through the severed spinal cord. Smaller, more subtle fractures can also occur. These fractures can occur in facet joints in the case of falls or motor vehicle accidents. Compression fractures can also occur. These are fractures in the spine that occur in the vertebral body as opposed to the lamina, pedicles, spinous processes, or transverse processes. Compression fractures are usually not through and through breaks, as occur often in long bones. Compression fractures are a crunching break of the spongy bone in the vertebral bodies. They are usually rather painful nonetheless. The appropriate treatment of different types of spine fractures varies greatly depending on the type and location. Some fractures, such as small compression fractures, will usually heal on their own. Other, more severe fractures of the spine can cause instability, which compromises the spinal cord. This sort of fracture must be treated immediately and usually requires surgical stabilization to protect the spinal cord and prevent paralysis. Prompt evaluation by a physician who is knowledgeable and experienced in dealing with spine injury and pain issues is needed for optimal treatment. The importance of appropriate pain management in all types of pain. Even in the situations described above, pain management is important. In these situations, the primary method of pain management is stopping whatever caused the pain in the first place. The secondary method of pain management is getting appropriate treatment for the acute injury involved. In the case of a blister, it would mean dressing the burn with antibiotic ointment and proper bandage. In the case of the broken bone, it may involve getting a cast on the break to stabilize it or possibly getting surgery to repair the damage. Once the offending cause of the pain has been stopped and proper assessment has been obtained, other methods of pain management, such as taking medications to help control the unpleasant sensations associated with pain, may be utilized. In the case of the spine fracture, proper management involves accurate diagnosis and appropriate initial treatment, which may simply be rest but may require extensive surgical stabilization. Management of the pain associated with the injury and the expected post-surgical pain is usually accomplished with medications. Once the fracture is stabilized, appropriate pain management usually involves physical therapy, non-opiate medications, and often opiate medications for severe pain. Over time, however, in most cases, pain decreases as the body heals, while functional abilities increase. Chronic pain versus acute pain. Acute pain is pain that lasts 3 months or less. Usually, acute pain falls into the categories described above. This type of pain is helpful in alerting us of injury and protecting us. The other type of pain that occurs is chronic pain. Chronic pain usually lasts more than 3 months. Often, chronic pain is not beneficial for our health or protection. By the end of 3 months, the acute cause of the pain is usually long gone, and the body has usually healed as much as it's going to. The pain that is left and persists often only serves to limit our function and decrease the quality of our lives. Chronic pain can actually have negative effects on our health. Chronic pain can decrease our immunity, increase our stress, interfere with our sleep, increase the likelihood of anxiety, cause or worsen depression, decrease our overall activity level, increase stress hormones like cortisol, and decrease our overall activity level, including activities that we would normally enjoy. While acute pain can actually protect us from injury and serves a beneficial function, chronic pain is maladaptive in many cases. Once your doctor has confirmed that your pain is no longer serving a useful purpose, efforts can be focused on minimizing the amount of persistent pain you have to endure and maximizing your overall functional level. In essence, the goal of a pain management physician is to reduce the overall amount of pain perceived while maximizing a person's involvement in the activities in which they want and need to participate in order to have a full and fulfilling life.